Hello, Dr. Furtado. I'm Dario Fernandez. I'm going to demonstrate the test for cranial nerve number 5, the trigeminal nerve. It is composed of the ophthalmic branch, which is sensory, the maxillary branch, which is sensory as well, and the mandibular branch, which is sensory and motor. The first test that I'm going to do is the corneal reflex. I'm going to use the wisp of a cotton ball. I'm going to ask my patient to turn her eyes to the left, and I'm going to lightly touch the outer cornea of her eye and observe for her eyes to blink. Both of her eyes did blink. That is a positive test. Intact. If one eye didn't blink, then I would test the opposite side, since the response is bilateral. In doing so, I'm able to identify whether it's the afferent portion of cranial nerve number 5 or the efferent portion of cranial nerve number 7, which is the facial nerve. Next test that I'm going to do is I'm going to test for the muscles of mastication, which include the temporalis, the masseter, and the medial and the lateral thyroid muscles. First thing I'm going to do is I'm going to ask my patient to open and close her mouth, and I'm going to observe for any deviation. If it deviates to the left, that left side is going to be the weak side. I'm also going to palpate the muscles, and I'm going to look for atrophy of the muscles. I'm going to palpate the masseter muscle, and I'm going to ask my patient to clench tightly. I can feel that masseter muscle contracting very strongly. The other thing that I'm going to do is I'm going to have my patient open her mouth and keep her mouth open. I'm going to apply a little bit of resistance to test the strength. Good. The next test that I'm going to do is I'm going to test the masseter reflex. I'm going to use my reflex hammer here. I'm going to have my patient open her mouth. I'm going to place my two fingers over her chin and just gently tap to observe her mouth close, and that is a normal response. If her mouth did demonstrate a hyperreactive motion, that is an indication of an upper motor neuron lesion. The last test that I'm going to do is I'm going to test sensation of the face. I'm going to use a sharp end of the paperclip as my sharp, and I'm going to use the cotton ball as my light touch. So the first thing that I want to do is make sure my patient understands the difference between the two. So I'll demonstrate that to the patient. And now this is going to be sharp, and this is going to be dull. This is going to be light. So when I touch you, you need to tell me whether it's sharp or whether it's light. I'm going to have her close her eyes. I'm going to test all 3 branches. Tell me if it's light or sharp. 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 Light. Light. Light, 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 light. And I'll test the mandibular branch as well in the same pattern. And what I'm looking for here is a diminished response or an absent response or even a report of pain on one particular side. And the last thing that I need to do is talk to you about the nuclei that are associated with the trigeminal nerve. In no particular order, the first nerve is the spinal nucleus. The first nucleus is the spinal nucleus. It is located in the medulla. It is associated with pain and temperature. The main sensory nucleus is associated with light touch of the face, and that is located in the upper pons. The spinal and the main sensory nucleus, the second order neuron, both travel to the VPM, and they synapse with the third order neuron, which will then travel to the primary somatosensory cortex. The third nucleus involved is the motor nucleus. The motor nucleus is associated with the lower motor neurons of the muscles of mastication, and that is located in the upper pons. And the last nucleus is the mesencephalic nucleus. The mesencephalic nucleus is located in the midbrain, and it is associated with the proprioception of the temporal mandibular joint. That is my assessment of cranial nerve number 5, trigeminal nerve. Thank you.